Bismillahirrahmanirrahim. The topic of our discussion is autoimmune hepatitis. So, autoimmune hepatitis is a chronic progressive disease resulting in inflammation of liver causing hepatitis. So, autoimmune hepatitis is an autoimmune response against the hepatocytes, which results in necrosis, which might lead to acute liver failure, and in certain cases, chronic liver failure. The risk factors include genetic predisposition, and the disease exhibits strong association with DRB1 alleles. In two-thirds of the cases, autoimmune hepatitis is associated with other autoimmune diseases such as vitiligo, rheumatoid arthritis, and Graves' disease. The disease is more common amongst the females than the males, and almost 78% of the cases of autoimmune hepatitis are amongst the females. So on basis of types of the antibodies, the disease is further subdivided into two types. Type 1 autoimmune hepatitis is more common in the middle and old age individuals. And the antibodies present in the serum in type 1 autoimmune hepatitis include anti-nuclear antibodies, anti-smooth muscle actin antibodies, anti-soluble liver antigen antibodies, and in some cases anti-mitochondrial antibodies might also be present. Type 2 autoimmune hepatitis is more common in children and teenagers. And the antibodies involved in type 2 autoimmune hepatitis include anti-liver kidney microsome 1 antibodies and anti-liver cytosol 1 antibodies. So HLA, DR3 and DR4 play a major role in type 1 autoimmune hepatitis. So HLA antigens are expressed on the surface of hepatocytes, and the antibodies are formed against these HLA antigens, resulting in damage to hepatocytes, causing necrosis and autoimmune hepatitis. In type 2 autoimmune hepatitis, cytochrome P450 is identified as an antigen. Cytochrome P450 is present in the cell membranes of hepatocytes. So anti-liver kidney microsome 1 antibodies are formed against these antigens, resulting in damage to cell membranes of hepatocytes, ultimately leading to autoimmune hepatitis. The morphological picture reveals severe necroinflammatory activity. Necro means necrosis, and there is presence of leukocytes as well, causing inflammation. The typical features of autoimmune hepatitis include interface hepatitis, which means there is inflammation of portal tract and it is extending into periportal zones. Periportal means surrounding the portal tract. Moreover, there is confluent hepatitis or confluent necrosis, which means necrosis involving multiple lobules of the liver. Perivenular necrosis means necrosis around central vein. The histological picture is taken from Robbin's textbook and it denotes interface hepatitis. Moreover, there are plasma cells also present along with the lymphocytes. So as you can see here, these are the plasma cells which are in excess. And the specific point to remember here is that hepatocytes form a specific pattern known as rosettes. Rosettes mean the pattern resembles the roses. This here is a rosette. As you can see here, this rosette pattern resembles the roses, and the rosettes are present in areas of increased inflammatory activity. So the disease is typically characterized by severe hepatocytes injury with widespread confluent necrosis and minimal scarring. Burned out cirrhosis might also be present in certain cases. Burned out means that the liver is actually cirrhosed, but there is no cellular activity suggestive of liver cirrhosis. So autoimmune hepatitis can be asymptomatic at first. The symptoms produced by autoimmune hepatitis include nausea, vomiting, loss of appetite. In certain cases, fever and jaundice might also be present. So the clinical picture actually resembles the acute viral hepatitis. But the disease actually does not resolve on treatment, and massive hepatocytes necrosis can progress into acute liver failure. Certain undiagnosed cases can also progress to chronic liver disease, and signs of chronic liver disease such as spider nevi, ascites, and portal hypertension, etc., might also be present. Serum bilirubin is mostly elevated, and there is also elevation in ALT and AST. The diagnosis begins with the detection of antibodies in the serum, such as ANA, ASMA, etc., and AKLM or anti-kidney liver microsome 1 antibodies in case of type 2 autoimmune hepatitis. Liver biopsy is done for histological studies. Before ordering of the biopsy, all the other causes of hepatitis must be ruled out. The definite diagnosis of autoimmune hepatitis is based on histological studies of the biopsy. The disease responds well to corticosteroids such as prednisolone, and remission can be achieved in almost 80% of the cases. Moreover, certain immunosuppressants such as azathioprine are also used. Liver transplant is done in cases of liver cirrhosis. There is 20% recurrence rate of autoimmune hepatitis even in cases of liver transplant. So this brings us to the end of discussion about autoimmune hepatitis. If you have any questions, do let us know in the comment section. Thank you.